This video focuses on nursing assessment of the musculoskeletal system. Viewing this topic will enhance your ability to identify common and concerning symptoms related to the musculoskeletal system, employ appropriate interviewing and techniques of therapeutic communication as you gather subjective data, perform a physical assessment of this system and its individual structures, distinguish normal from abnormal findings as you assess, and document and communicate findings from the musculoskeletal assessment clearly and accurately. The musculoskeletal system comprises bones, joints, and tendons, muscles, and ligaments.
The structure and mobility of the human body are dependent upon a healthy musculoskeletal system. Problems here tend to have a significant impact on a client's level of functioning and quality of life, often leading to long-term health problems that can affect virtually any area of the body. Musculoskeletal problems are among the leading causes of clinical visits by clients of every age, gender, and ethnicity, with frequency and severity increasing with age. These clients' complaints most often concern pain or stiffness. That's why subjective data collection is especially important when assessing the musculoskeletal system.
Common and concerning problems of the musculoskeletal system include pain or discomfort, stiffness or limited movement, weakness, deformity, and lack of balance and coordination.
It is important to ask your client about each of these concerns. Whenever the client indicates a positive response, use effective communication techniques to gather more detailed information. Mr. Anders is a 21-year-old man visiting the clinic today for a head-to-toe physical assessment as preparation for participation in his university's fall sports season.
Hi, Mr. Anders. My name is Tim. I'll be your nurse today.
Begin the interview by establishing rapport. Introduce yourself to the client. Explain why you are conducting the interview and how your session will proceed from health history taking through the physical examination.
Tell me, what brings you in to see us?
I need a complete sports physical for my senior year at the U.
Okay, well, what sport do you play?
Rugby. I'm a forward.
Wow, that's a tough sport and a rougher position. Let's start with a series of questions that will help us understand your current state of health. And later I'll perform a physical assessment if that's okay.
Sure. Is it all right if I take my jacket off?
Oh, by all means, make yourself comfortable.
The musculoskeletal portion of the head-to-toe assessment begins right at the start of your interview, when you take advantage of every opportunity to evaluate the client's posture while sitting, and, if possible, while standing. Also observe the client's gait and balance, and coordination.
Let's start by gathering some background data. We've already checked your vital signs, and I see that you're 21 years old. Can you tell me in your own words how you feel your overall health is? Any problems or concerns that you're having?
No, everything seems okay.
Your medical record says that you were here 2 years ago with a dislocated shoulder and a year ago with a left sprained wrist.
Right.
Is everything back to normal? Any problems in these areas such as pain, stiffness, or limited range of motion?
No problems. Everything's fine now.
Your form shows that you're not currently taking any medications, is that correct?
You mean prescriptions and stuff?
Yes, and over-the-counter medications.
No, I'm not.
Are you allergic to any medications?
No, I don't think so.
Okay. I only have a few more questions about your past medical history, and especially those injuries, as well as your family history and social history. Then we'll do a full head-to-toe assessment, and we'll take an especially close look at your musculoskeletal system, just to make sure that you're ready for the fall season, okay?
Sounds good.
All right.
Continue to explore aspects of the client's health history, symptoms, activities of daily living, and life circumstances to ensure a comprehensive reporting of data. After completing your subjective data collection, document your findings thoroughly in the client's health record. Be sure to report both positive and negative findings clearly and accurately. Provide details about any positive findings to give as clear a picture as possible about the client's current health concerns.
Ready, Mr. Anders?
Yes, sir.
After interviewing to obtain subjective data, assess to obtain objective data.
For learning purposes, this video will demonstrate a comprehensive physical examination of the musculoskeletal system. In actual practice, nurses may use only a subset of these techniques, depending on the client's chief concern, health history, the healthcare setting, or other parameters. A comprehensive physical assessment of the musculoskeletal system will generally move from head to toe and will typically involve inspection, measurements, palpation, and tests for range of motion and muscle strength.
When conducting a comprehensive musculoskeletal examination, the nurse may wish to rearrange the sequence of assessment steps in order to minimize the number of times the client must mount and dismount the examination table. This is especially important for older clients who experience decreased balance, strength, and agility, reduced range of motion, and stiffness in their joints. Make sure your hands are warm before touching the client.
The following tools and supplies are generally used in the nursing assessment of the musculoskeletal system: examination gown and drape, and goniometer, a tool for measuring the angle to which a joint can flex or extend. For the purposes of demonstration, in this video, the client is not gowned or draped.
Begin by assessing posture, gait, mobility, and balance. Ask the client to stand with feet together. Observe for symmetry in the scapulae and iliac crests and compare shoulder height. Assess the relation of the head, trunk, pelvis, and extremities. Next, assess gait and mobility.
The client's posture is erect with the head midline above the spine. The left shoulder is slightly higher than the right.
Unless the client exhibits a problem with gait, assess for balance next.
Next, I'm going to ask you to walk towards the door. This time I would like you to walk on your tiptoes. Good. Can you walk back towards me? This time walk on your heels. Great. Now I'm going to ask you to walk towards the door one more time, this time heel to toe, like you're walking a straight line. Now, if you would you walk backwards? Just walk straight backwards towards me. I'll make sure you don't hit the table. Good. All right, you can turn around. Why don't you step to the side, step to the right for me? Now step to the left. Good job. The client rises from a sitting position with ease. His walk is smooth and rhythmic, with the arms swinging in opposition to the legs. His weight is evenly distributed. Movements are coordinated and rhythmic. His stride length is average.
Next, assess the client's TMJ, or temporomandibular joint.
Now I'm going to examine the joints of your mouth and jaw.
Here, as elsewhere, healthy joints will move smoothly and quietly.
Can you move your jaw side to side? Great. Now move your jaw forward and back. Now can you clench your teeth for me? Real tight. Great job.
Caution. When assessing range of motion, never force a joint beyond its normal range, and stop moving the joint or applying full resistance if the client experiences discomfort or pain. Full resistance means that the nurse's hand provides sufficient pressure on a joint so that the client must exert a significant amount of force against it to complete the full range of motion. Note also that joints are palpated for contour and size, while muscles are palpated for tone.
The client's jaw moves laterally approximately 2 centimeters. His mouth opens and closes smoothly. It opens approximately 1.5 centimeters as measured between upper and lower teeth. His jaw protrudes and retracts easily. Contraction palpated with no pain or spasm. Teeth aligned correctly. He has full range of motion.
Next, assist the client to stand and ask him to stand straight and still. Then inspect the cervical, thoracic, and lumbar sections of the spine. First observe from the side, then repeat your observation from the back, assessing for symmetry of shoulder height and iliac crests. Next, palpate the spinous processes and the paravertebral muscles on both sides of the spine for tenderness. Then test the range of motion of the cervical spine.
Okay, I need you to touch your chin to your chest for me. Bring your head up, all the way back to the ceiling. Good, now look straight at me. Now I'd like you to touch your ear to your shoulder. Bring your head up, and let's do the other side. Try not to move your shoulder. Bring your head up, look to your right. Good. Now look at me and look to the left. Okay, look straight ahead. Now this time, I want you to turn your head to the right and push against my hand. We're going to do the other side. Push against my hand. Good job. Client's spine appears straight. His muscles appear fully developed, symmetric, and non-tender without spasm. He has full range of motion in all directions. His strength is 5 out of 5 against resistance.
Perform additional range of motion tests for the thoracic and lumbar spines.
All right, I need you to touch your toes. Stand up and arch back if you can. Good, stand straight up. Lean to the right. And now lean to the left. Come up. I want you to twist to the right and twist to the left. Excellent. The client's thoracic and lumbar flexion movements are smooth. Lateral bending, hyperextension, and rotation show full range of motion.
Next, assess the shoulders and arms for color, swelling, and masses. Compare to assess symmetry. Inspect anteriorly and posteriorly. Inspect the sternoclavicular joint. Assess for location at midline, swelling, color, and masses. Palpate for tenderness and pain. Then palpate the shoulders and arms for tenderness, swelling, or heat. First, anteriorly at the clavicle, acromioclavicular joint, the subacromial area, and the biceps.
And the other side.
Then palpate posteriorly at the glenohumeral joint,
and your muscles.
the coracoid area, trapezius muscle, and scapular area.
And again on this side. Is there any tenderness? Or any pain? Good job. Shoulders and arms symmetric without redness, swelling, deformity, or heat. Muscles are fully developed and smooth. Clavicles and scapulae are even and symmetric. The client denies tenderness. Okay, I'm going to ask you to perform some more range of motion movements of your shoulders and arms. Let me know if at any time you have any discomfort or pain. Let's begin with bringing our arms out in front of you. Now bring them as far back as you can go. Now bring them to your side. Now let's raise our arms to our sides with our palms down. Now let's bring our palms up and over our heads. Now bring your Arms and hands behind your head. Now behind our back. Good job. Shoulders and arms have full range of motion bilaterally. Extend your arms for me to your side.
Next, inspect the elbows for size, shape, redness, swelling, and deformities with the client's arms extended and flexed. Compare to assess symmetry. Then, with the client's elbows relaxed and flexed, use your thumb and middle finger to palpate the olecranon process and epicondyles for tenderness and nodules. Palpate each elbow separately.
Now I'm going to test the range of motion of your elbows. Can you bring your right arm up towards your shoulder? Then lower the arm to straighten your elbow. And bring it straight out in front of you. Now rotate your palm down and rotate it up. Now let's do the other arm. Okay, that was great. Let's do it again, this time with resistance. I need you to pull me in towards you and push me away. Good. Let's do the other side.
Note that it is normal for a client to display greater muscle strength, coordination, and range of motion on the dominant side. When reporting muscle strength, employ a 0 to 5 rating scale as follows. 0 indicates no muscle contraction or paralysis. 1 indicates a slight degree of contraction and is reported as severe weakness. 2 indicates passive range of motion, meaning that gravity is removed and the client is assisted by the nurse. This is reported as poor range of motion. 3 indicates active motion against gravity or average weakness. 4 indicates active motion against partial resistance or slight weakness. And 5 indicates active motion against full resistance and is considered normal.
Note that if the client reveals a limited range of motion, you may wish to employ a goniometer to measure, in degrees, the range of motion the client is capable of.
Elbows are symmetric without redness, deformities, or swelling. They are non-tender without nodules. Full range of motion bilaterally. Strength is 5 out of 5 against resistance. Let me know if you have any tenderness or pain, okay?
Next, inspect the wrists for size, shape, color, and swelling. Compare to assess symmetry. Then palpate each for tenderness and nodules. Palpate the anatomic snuff box, which is the hollow area on the back of the wrist at the base of the fully extended thumb.
Next, we're going to test range of motion of your wrists. Let's bring your wrists and hands up. Now, can you bend your hands downward like this? Great. Now let's bring them up. Now bring them all the way up to the ceiling. Good. Let's bring them straight. Let's move them in and out. Good job. Let's bring them straight. This time I want you to bring them up against my hand, please. All right. Now I would like you to push them down. Okay. Any pain or tenderness in that left wrist? Okay. The client's wrist symmetric without redness and free of nodules. There is no tenderness noted in the anatomic snuff box. He is able to perform full range of motion. Strength 5 out of 5 against resistance. Next, I'm going to feel your hands. Let me know if you feel any pain or tenderness.
Inspect the fingers for size, shape, color, and swelling. Compare to assess symmetry. Bilaterally palpate each metacarpal, noting tenderness and swelling. Assess the metacarpophalangeal joints by squeezing the hand from the side between your thumb and fingers. Palpate from the proximal to the distal end, noting for each interphalangeal joint swelling, tenderness, bony prominences, nodules, or crepitus.
The client's hands and fingers are straight and symmetric without nodules. No swelling or deformities are noted.
Next, test range of motion.
Can you hold your hands up for me and spread your fingers?
Test abduction,
Now let's make a fist.
adduction,
Now can you straighten your hands and fingers for me? Good. Now bend your fingers downward.
flexion,
Now bring them up. And can you pull them all the way backwards?
hyperextension,
Great. Now let's roll our hands over like this. And you take your thumbs and bring them out.
test thumb hyperextension,
Now let's touch our pinkies with our thumb. Perfect. Now, I'm also going to do this with resistance. So I'd like you to spread your fingers for me one more time. Keep me from pulling your fingers together. Good. Now, can you squeeze, make a fist and squeeze my fingers? Good. Now let's put our thumb and pinkies together and keep me from pulling it apart. Great. The client has full range of motion bilaterally. Strength is 5 out of 5 against resistance. All right, Mr. Anders, can we get you up one more time? I want to take a quick look at your hips.
Next, inspect the hips for symmetry and shape. Then palpate posteriorly for tenderness, crepitus, and stability.
Iliac crests are symmetric in height. Hips are stable, non-tender, and without crepitus.
Now assist the client onto the examination table and into the supine position.
Okay, can you pull this knee to your chest for me?
Test range of motion of the hips.
Caution. When assessing clients who have had a total hip replacement, always obtain physician permission before testing hip range of motion, and take care to avoid dislocation of the prosthesis.
And the other knee to your chest. Great, now straighten that leg out. Now can you roll on your hip forward? Good, now with a straight leg, I'd like you to bring this leg as far back as you can go. Good. Roll back onto your back. All right, now I'm just going to move your leg. Okay, now let's flex your knee. Very good. Are you all right? Good. I'm going to move to the other side of the table and we'll do the other leg. The client has full range of motion bilaterally.
Next, inspect the knees for size, shape, alignment, swelling, and deformities. Compare to assess symmetry. Assess for quadriceps muscle atrophy. Then palpate both knees for nodules, consistency, tenderness, and warmth. Begin about 10 centimeters above the patella, using your thumb and fingers to move downward toward the knee. Repeat your inspection and palpation with the client sitting up.
And let me know if you feel any tenderness or pain. The client's upper and lower legs are in alignment. Knees are symmetric. There is no swelling or deformities noted. Knees are non-tender and cool to touch. Muscles are firm, no nodules present.
Next, with the client standing, test range of motion.
I'm going to ask you to bend each knee. Feel free to lean on me if you need to. Let's bend the right knee. Now straighten the leg and extend it, please. Perfect. Now would you bend the left knee for me?
Repeat the flexion and extension tests against resistance with the client in a sitting position.
Now push them out. Excellent. The client has full range of motion bilaterally. Strength is 5 out of 5 against resistance.
As opportunity presents, inspect the ankles and feet with the client sitting, standing, and walking. Assess position, alignment, and shape. Inspect the skin for general appearance.
The client's feet and toes are in alignment. No gross deformities noted.
With the client supine, palpate the ankles, then the feet, assessing contour and size. Note tenderness, swelling, bony prominences, nodules, and crepitus. Looking also for heat, squeeze each foot from the sides with your thumb and fingers to assess the metatarsophalangeal joints. Palpate each metatarsal. Then the plantar area. Palpate the toes for tenderness, swelling, bony prominences, nodules, and crepitus at each interphalangeal joint, moving from the proximal to the distal end.
Feet and toes are warm and non-tender to palpation.
Test range of motion, assessing both feet simultaneously.
Can you point your toes upward for me, both feet at the same time? Now downward. Now turn your soles outward. Now inward. Now rotate your feet outward. And now inward. Now bend your toes downward and upward. Excellent. Now let's try the same thing against my resistance. We'll do it 1 foot at a time this time. The client has full range of motion bilaterally. Strength is 5 out of 5 against resistance.
While lengthy and detailed, a comprehensive assessment of the musculoskeletal system is an essential tool for evaluating a client's level of functioning as it relates to activities of daily living. Accurate gathering, documenting, and communicating of findings can help to optimize a client's existing function and initiate critical steps for any needed interventions. After completing your objective data collection, document both positive and negative findings using the correct phrasing of the documentation of normal findings as demonstrated during the assessment.